Now, I want to talk about my amazing colleague over here. He wahine toa, he mama, he mahi o ngā mahi, Huri Campbell. So Huri and I were tasked with the Taitamariki aspect of our research, but I just want to talk about Huri for a moment because she's a big part of our research team. Oh, she does all the mahi. She's got plenty of the tamariki and plenty of the mahi as well. But every time you see her, she always has a beautiful smile on her face. Every time her and I hui, she's like, oh, mete, we have to get these tasks done. It's like, okay, we'll just get it done. And that's kind of the vibe that we have. And yeah, I just want to really acknowledge you for your mahi in this space. He uria no te tai tokero, no te hokianga whānui nei. So yeah, big mahi to you and your mahi. And together, we are actually going to present our Taitamariki findings. Ka pai. So, as I mentioned, Huri and I were tasked with adding on the Taitamariki aspect because we had heard from many other whānau, but there was an evident gap within the kōrero that had been presented. And that gap was hearing the voices of our Taitamariki. He kupu mai te nota Taitamariki, also known as rangatahi or taiohi. However, for the purpose of our research, we use the kupu Taitamariki. And so our aim actually was to produce a uniquely Māori holistic prevention that optimises oranga whānau with a focus on harm elimination, and also to acknowledge that Taitamariki have aspirational and successful futures. He rangatira moa pōpō ne. So just our little tongikura, ko te Māori, he mea huna i te moana. So unlocking and unravelling our potential to heal. And with that, we were able to work alongside our Taitamariki from across the motu.
Kia ora te wai. Yes, I'm extremely privileged to be able to work in this project alongside Whai Denise and Whai Awai, Te Wai, and all of the other research team. So when we did the bigger study, so first we went out for our first lot of wānanga and we heard from whānau about their experiences of domestic violence. So this is in the big study. The second lot of wānanga that we did across the sites was about finding solutions. So we went back to whānau and we said, you've told us your kōrero. What are your solutions? Because we know as Māori that we have the solutions to our take or our issues. So from the second lot of wānanga, it was very clear that we needed a Taitamariki voice. So Whai Denise then voluntold Te Wai and I and said that we actually had to go out to service providers and we had to find our Taitamariki and we had to hear their kōrero and we had to hear their solutions. So that's how it came to be that we were like a little bit of a sub-study of the bigger study. And I just want to mihi to our Taitamariki. Ka nui nei te mihi ki ngā Taitamariki roto i tēnei kaupapa nei kua whai wā ki te whakawhiti kōrero kia mawatahi ko Te Wai. There would be no study without their kōrero, and I just really want to mihi to them for their bravery and their resilience in their day-to-day. So the next, so how do we do it? Our kai uru, or our participants, were aged 15 to 25, and across 3 sites we had a total of 40 participants, including kai mahi, who were also Taitamariki too, so that was really great. And we decided to do 3 wānanga, so we had 3 separate sites. Given the scope of the project and the time, we only went out for 1 wānanga with Taitamariki, and we felt that that was enough to hear their experiences and get their solutions too. So what we did is when we were looking at the sites that we were going to, lucky enough, Te Wai is extremely well connected because she does this mahi day in and day out. So she was able to hook us in to 3 service providers that rolled out the red carpet for her. So through the whakapapa connections, we were able to do that seamlessly. What we then did was we aligned the dates of our wānanga to the most favourable dates of the maramataka, and we tried to align the Gregorian calendar and the maramataka together so we could optimise our wānanga and our kōrero with Taitamariki. So we were lucky enough to do that in the study.
Ka pai. Right, so ngā pātai, what did we want to ask the Taitamariki when we engaged with them? We all know how research works, eh? You have a question in mind. Wherever the kōrero leads to is where it's meant to have gone. So originally, our pātai, so we asked a series of pātai, semi-structured wānanga we held. If you're feeling low or going through a tough time, who or what helps you get through those feelings? And can you think of a time when someone supported you? What did they do that made it really helpful? These pātai were used to initiate the kōrero. A lot of the times the Taitamariki would just have a bit of chatter and banter between themselves, and from there we were able to pick up on aspects of their kōrero of like, oh, okay, so perhaps this is the choice of wording that they prefer to use. Or we were asked in return, oh, what do you mean by that? What do you mean by when someone supported you? Like when they supported me on the rugby field, when they supported me through, different times in my life. And so we had to further unpack these. And the rangatahi, we use the research term semi-structured focus groups. In our research, we use a lot of wānanga style. So we were sitting around in the different environments having kai and kōrero, because it's much easier to talk about things when you're having a kai. Okay, so take that tip away if you're going to do some more. A happy puku means that they'll be much more happier to connect, and we start to break down some of those barriers. So these are just some of the initial pātai that we asked. As we went through, they all had the same baseline, however, depended on the different location and service we went into, we would have to alter how we ask the questions or how we approach the kōrero, based off of the wairua on that day as well, checking in with everyone, seeing how they were feeling. And then, fortunately, both Huri and I were able to pivot when needed to ask the right questions so that we opened up that space for the Taitamariki to continue sharing their kōrero.
Ka pai. And I just do want to say that, yeah, they were really cool. They kept us young, eh? Like teaching us about terms that we've never heard of before. So it was actually a really cool part of the study, because although it was a kaupapa like taumaha, it was very heavy. It just showed how really resilient and resourceful our Taitamariki are. So we asked them, hea ngā take nui, like what are your issues or that you're experiencing at the moment? And so one of the first ones, so after we analysed the data, the kōrero, we found that lack of culturally relevant services is a huge take for our Taitamariki. They don't like to engage in services where they don't see themselves or they see their whānau in those services. And they'll just avoid them if they have to. So yeah, that was a big take. Another take for them was a lack of safe spaces and feeling helpless in abusive environments. Yeah, and that was actually really quite hard to hear, because it's all around them, so abuse is around them, and yet there's nothing that they can do about it, and there's nowhere that they can get help either. Another take for them was lack of early interventions. So that's not the word that they used, but that's a more PG word here. So they just wanted to know, they said, we don't know what we don't know. And we need some help to learn about some of the things that we think that we might need to learn about. Another one was disconnection in whānau and intergenerational trauma. And that's also similar to the bigger study. So some of the findings that come out of the bigger study were actually the same as what the Taitamariki were saying, which is quite interesting. And the last one was fear of seeking help due to system mistrust, which again ties back to the lack of culturally relevant services. So they were saying, we don't want white spaces. You know, we've seen our parents become victims of their kōrero in those spaces, and we don't want to do the same.
So we're going to start unpacking some of our themes that came out of the kōrero. The first one being that mainstream services are not always safe or relatable for Māori youth, for our Taitamariki Māori, or lack of culturally relevant services. This was a big key finding that our Taitamariki were very confident in talking about. They knew what would help them if they were to engage in services. They knew what they needed and the type of environment that they needed. Some of our quotes that have been shared, we had to really sift through some for a bit more of a censored presentation. But I think that's also a true reflection of the whanaungatanga and the connections and how the Taitamariki felt safe talking with us, because they were able to use language that they preferred to use. And as Huri said, we did learn some of their new kupu, their new slang that they're using, and holy moly, I felt old. So, jingos, never heard that one before. Hui anō, we were hearing some of the kōrero that they presented to us. So they'd rather talk to a friend than a counsellor. And as many of us, practitioners, kaimahi in these spaces, you often think, like if they'd rather talk to a friend, we have had to learn and grow and develop to be able to hold space for the whānau and the tamariki and the rangatahi and taitamariki that we're working alongside. So imagine when our taitamariki, they would rather talk to their friends and their friends hold that space, and they're still just navigating their current developmental stage, really. So there's a lot of hara that they carry, but there's a lot of taumaha there. The other one is talking to a tuakana. It's easier to talk to them and they make it simple. Who's the youngest of the whānau around here? Any pōtiki? Yeah, it is easier talking to a mātamu, to the mātamu of the whānau, or the tuakana. But again, that highlights the tuakana taina approach that we consistently talk about in many of our spaces, and also within our whānau. Our taitamariki would rather talk to their tuakana. And then they also stated that young Māori kids do not want to talk to old white ladies about their problems. And it's basically because, again, it comes down to the way in which we can make those connections. Building those connections and making sure that we can provide services that are culturally relevant to our taitamariki, so that A, they want to be there. They already want to have the help, but it's about how can the support and the guidance and the services better ensure the health needs of our whānau of our taitamariki are being met. Ka pai.
The next one. So lack of safe spaces and feeling helpless in abusive environments. So Taitamariki lack safe spaces and don't trust the places that are available and are secure. So in this one, what they actually said was, we know we're the women's refuges. And that was, that actually buzzed me out, because they said, everybody knows where it is. So, there's nowhere safe for us to go. It's hard to leave in the first place, and then if we're leaving to go to a place where everyone knows where you're going to be, we're going to be, definitely not safe at those spaces. So some of the excerpts that they said was, if I stay, I'll see it. If I leave, my brothers will get it. If I get in the middle, I'll get it. These are their lived realities. And it's not a fairy tale. They live in abuse. So Another one was you feel like there's no other option, the outcome will always be the same. And what was interesting in one wānanga, one of the participants actually said when we were just having a yānanga o kōrero, she said, "Oh my goodness, I think I've become the abuser." She was young, so that was really powerful too, because it goes back to what, the Taitamariki were saying to us is you don't know what you don't know. And, like kwa taka te kapa, she thinks now that she's an abuser. So, so that was a really powerful kōrero in the study.
And our third one was the lack of early interventions. So the standard questioning that's asked is done at the wrong place or at the wrong time, and it doesn't provide safety. Because when you are in a heightened way within your body, sometimes when we're in stressful situations, we're like, our heart's racing, we're a bit clammy in that, and then you're getting asked questions about, are you safe, or is there violence happening, and all these other different questions. You can't quite actually comprehend and respond appropriately to the support that you need. Because you are literally in that fight, flight, freeze situation, and those responses will obviously reflect that. And so ensuring that the interventions the early interventions are there, because that was the massive kōrero from our Taitamariki, was, when we're going through it, there's nothing there. And so when they talk about the questioning, it's like, that's the last thing they want to focus on, is the questions, because they felt like it was tick boxy. They're just a tick box, and when they ask about violence at the hospital, it's just like, there's one question, it's kind of a yes or no answer, and no matter what response you get, they've ticked the box. That's how our Taitamariki felt. And we this particular kōrero comes from one of the service providers who work alongside mātua taiohi, our teenage parents. And so they have been through these experiences post-birth, and through their journey of raising their tamariki. Another one, it's like a 70-year-old doctor telling you, a 7-year-old white doctor, I'd never tell you, because they just don't feel there is that connection that they can create. This is just somebody they might be seeing for like a few minutes. And they kind of have to, offload, okay, this is everything I'm going through, with the fear of being judged, with the fear of all the other consequences that come from whatever answer they're going to give. And so, the importance of ensuring that there is some early interventions is heightened with our Taitamariki, which then brings us on to the next kōrero,
which is disconnection in whānau and intergenerational trauma. So similar to the main study, lots of our Taitamariki felt like that they were just in a whānau of one. So for some that had their parents or their mums actually had moved different places because of abuse, and so they actually had to leave their wider whānau. They just felt really disconnected. And also intergenerational trauma. Another thing actually that was really strong in one of the wānanga was te ao Māori. So lots of our Taitamariki felt that a key component to their oranga and their rangatiratanga was their ao Māori. And I thought that was really cool, that they actually recognised that themselves. So they said things like swimming in your awa, taking a hikoi on your whenua, in the ngahere, having a krakia. Those were all of the things that brought them oranga when they were in really dark places. So they just felt like that te ao Māori was their rongoa. And it's true, ko te oranga o te iwi Māori roto I tō tātou nei rongoa. And another... let's have a look. Another thing was whakapapa. So severed ties to whakapapa was huge for our Taitamariki. They wanted to know where they're from. They wanted to know who their whānau were. And also when they were removed, some of them were removed from state, they would have liked to have been placed with whānau instead of being placed with caregivers that have no whakapapa connection to them. So navigating whānau relationships, some kōrero was, my dad or my uncles probably think I'm of that age. That's how they were taught. That was in relation to intergenerational trauma and violence and abuse. Taking away that adult child stigma, you're the child, I'm the adult, that just makes you feel like tiko. So what was really strong actually in the wānanga and the kōrero is that they felt like that they had no voice. They had no voice in their whānau. You just shut up and be quiet. And another one was kids do not get a say, and I hope that changes. So.
Ka pai. And our last finding from the analysis of the kōrero was the fear of seeking help due to system mistrust. So Taitamariki feared seeking help, as there's a huge mistrust with oranga tamariki, the police and the hospitals. Like we mentioned earlier, the answer you give to these pātai will determine your outcome most of the times. And that sat quite heavy with our Taitamariki because they had seen it. They'd seen it through their whānau, they had heard about it through the intergenerational trauma that was passed down, and for quite a lot of them, they had experienced it firsthand. And so because of that mistrust, a lot of their kōrero was around, if I say yes, what are they going to do anyway? Because even if you admit that there's stuff going on, nothing's going to happen for you, you're going to stay in that same situation. The flip side of that is, if you did say yes, what's going to happen? Am I going to be taken away? Is my baby going to be taken away? Are my little siblings going to be taken away? So it always came with a double-edged experience for them. And the other one was that she hasn't gone because she doesn't trust the system. It's safer to stay in a violent situation than it is to be involved in the system. And that right there is massive for our people, because your life is either at the hands of someone else or under the current systems that are meant to be there to protect and serve our people. So for a lot of times, the Taitamariki, they're lost. They don't know what they should be doing. What they do know is they need to protect themselves. They need to protect for most part, they need to protect their mama, and they need to protect their siblings. They don't often seek help in those systems because it's a lucky dip. Some of them actually said it's a lucky dip. What are they going to do? If they do something, it's probably not going to be the greatest outcome anyway. If they don't do something, then, we just have to learn to protect ourselves and our whare.
Ka pai. Ngā matawara te whānau. So what Taitamariki need? So the findings indicated that we need them to thrive. We need them to stay safe. We need their voice. We need to be advocates for them in our spaces, and we need to create rauemi that can help them in their oranga, their tupuranga and their rangatiratanga. They have the solutions, and we have to help with the prevention. We need strong connections for them, and also healing.
So again, this is the part of the wānanga that we had alongside the Taitamariki, is that our initial pātai after building that trust and engagement with them, bearing in mind we might have spent an hour at times with some of the Taitamariki. I guess this is a reflection of, it's not the length of time you get to spend, it's the quality of time that you get to spend alongside our Taitamariki. And so we had to hold space for them as we asked our initial and early questions to them, so that they could release what they had been holding on to. So Huri and I, we definitely are privileged to hold that space for the Taitamariki who partook in our research. And this is where we get to go into them, the rongoa being inside of them, the solutions being inside of them. We just were in a position to help bring that out. And so one of them is Hea hai wā rātou o tinga. So what were their solutions? So it was to have for Māori by Māori services, culturally safe advocacy and support, dedicated housing and secure refuge for young mama, education about abuse and healthy relationships, having some help-seeking tools, and also strength-based peer support and role modelling. These were some of the main solutions that our Taitamariki came up with. They knew what the issue was. They needed that space to talk about it so that they could come up with the solutions. Now, this is all guided and directed by them of what they know will work.
Ka pai. And these are just some of the kōrero from them. So by Māori, for Māori is the only way. Wai tā para is good because they actually do with you. So these are exact excerpts from the kōrero about these different solutions.
Ka pai. So around the culturally safe advocacy and support, just knowing someone is going to stick by her and not take her babies away, advocating for the mokopuna so they don't become another number in the system. Kids are walking around the street because they don't feel comfortable at home, and just having a home or something safe, like a place where you can come back to. So having that support and especially around housing, many of our mātua taiuhi, our young mama, were wanting stable and secure housing so that they could have a safe space and a safe home for them to raise their pipi. But also for our other Taitamariki, they wanted a safe home wherever they were. And oftentimes rurality, so people that are living in rural areas, it's a struggle for them, and that was a key kōrero that they needed. They need to have that safe space where they can go to and know that everything will be okay.
It's the time. Yeah. Ka pai. And just some kōrero, dedicated housing and secure refuge for young mama. Again, you need someone who actually talks to you and knows your situation, not just a house mum that ignores you. Again, that kōrero about women's refuge, they all know where it is. We've got some practical solutions that are coming up next, that after the excerpts, that actually show things that tools for service providers that might be able to provide some of this hihia of our Taitamariki. They wanted education about, te wai the thing? Ka pai. Education about abuse and healthy relationships. So this was a big one. Like lots of them said, we were raised and we didn't see a healthy relationship, so we don't know what that looks like. And so some of the kōrero was, I didn't even know I was being abused until I learnt about the silent treatment. And a quiz that shows what kind of abuse you're giving and getting would be buzzy but useful. Again, they don't know about healthy relationships. Another one was help-seeking tools. This was really cool. They had lots of these tools. So like at the bar, you can say angel shot, and then you can get help quietly from bartenders. I didn't know anything about that. And use posters in gyms and in wharemimi. So they're saying like public toilets and that, put posters up about different kinds of places where they can get help. Create a helpline with people who've actually experienced what you're going through. So this was like a number that you call or that you text, and then they can ring you back, because from the wānanga they said their phones aren't always safe, so they can't always just messenger their friends like, this is what's happening with me now, and they desperately need to speak with someone like any time of the day or the night. And so those were some of the things that they asked, like if they could get help, but secretly get help, you know. Also, most of the time they do communicate via social media, which is obviously no surprise to us. So help-seeking tools on social media would be great. What we did experience in the study, though, is after the end of the study, how do we continue to update those social media channels for our Taitamariki? And so that was something that I'm actually just going to chuck it out there to the service providers in the room that may have Taitamariki who work in your service, who run your social media pages, that may be able to do that. Yeah.
I think what you'll find throughout the day is we're going to be putting a lot of tono out. So, take up any of these requests. I would love to see how the rangatahi findings are then implemented at the service level as well. Ka pai. So, our next one is the strength-based peer support and role modelling. Our Taitamariki, they spoke about, the importance of having peer support and role modelling. Having the auntie that just chucked me in the car and said, "Come live with me." How, that kind of feels like normal, eh? Like, yeah, you always have that one auntie, like, come on, she gets all the kids, keeps them, and can help bring them on track, give them that safe space to be in. But also, I can say that's the whole reason I am here. I was that youth once. So that Taitamariki who needed that strength-based peer support and role modelling, that positive role modelling in these spaces is hugely important. And you do what you wish someone would have done for you when you were going through it. So, but having that lived experience, going through those different situations firsthand, coming out the other side, and then using that as their tool to support others that might be going through the same situations was hugely important for our Taitamariki, and a really big reason as to why they do what they were doing, the different kind of mahi that they were doing, but also why they were able to share effectively with us throughout the time we spent together.
Ka pai. So, based on all of the wānanga, the resource outputs that Te Wai and I have developed for this study include tools for whānau and service providers, and we can go through some of those things shortly. We also have an academic article that we are going to write. And then in the bigger study, we have got where to get help. So that's what Taitamariki wanted to know, like where do we get help, and also a protection order pathway. So the 3 and 4 are actually part of the big study resource too, but those are specific things that Taitamariki can use as well. So Te Wai will just go over our tools for supporting whānau and service providers. We've only got a couple more slides left. Ka pai.
Ka pai. So some of our tools that we have are, one is the culturally relevant services. So developing for Māori by Māori service, including tikanga, reo, mātauranga Māori, and ensuring services are culturally safe and relatable to reduce mistrust. The second one, safe spaces. Establishing dedicated safe space for Taitamariki, young parents and victims of violence, provide secure refuge and housing for young mama and their piepi. The next one is early intervention, engaging Taitamariki at the right time and place where they feel safe. Train staff to identify early signs of distress and intervene appropriately. This was a key kōrero because oftentimes, by the time any kind of service gets involved, the energy, the situation has already been heightened, whereas Taitamariki were like, if they can just understand us more and get in earlier, that would be better. It wouldn't have, resulted in the situation going this way, or it wouldn't have, placed so much pressure on my own hauora. That's one thing that they really, really want to see, as well as whānau and relationship support. So strengthening those whānau connections and helping Taitamariki navigate relationships. Another huge thing, because oftentimes, and the Taitamariki spoke about it when we had our time with them, and they're like, oh, that's just normal. That's just what I've seen. It wasn't until I went outside and spoke with other people that what was happening at home isn't actually okay. It's because what we grow up around, we think, oh, yeah, that's normal. Or that's the normal belief for many of us. But yeah, it's not until we either the Taitamariki are exposed to other situations, or have access to services that can help them understand. Okay, this isn't normal behaviour. I don't think this should be okay, and this is not a safe situation for me. And then also offer whānau inclusive programs to prevent the isolation. Because again, oftentimes if they respond yes to a question and they actually get that support that's put in place, the harm that is caused is that they are then isolated. Whereas they want a solution where it's whānau centred, whānau inclusive, so that everyone can heal and grow instead of isolating our whānau.
And then the last one, let's have a look, is peer support. So tuakana teina models of mentoring and leadership. I know lots of our providers do this already, our Māori providers in particular, actually, develop strength-based peer support networks and role models. So in the study, like their hoa is the person that's giving them advice that is navigating their ao as well. So if we had young people in services that could offer that type of support, it would be amazing. Provide advocacy and representation, so provide Taitamariki with culturally safe advocates, and support their voices in decision-making spaces. So it doesn't hurt going out for a wānanga or consultation with Taitamariki when you're looking at systems or processes within services. You already have the connect there anyway. It's lovely to get their voice on things because some of the things we may miss as adults. Education and resources, so deliver education on abuse prevention and healthy relationships. So that's really important. We've said it through the whole kōrero, as they want to know how to have healthy relationships. And then creating accessible health-seeking tools designed with Taitamariki input. They could be like at the front of your service provider, wherever you are, where they can just pick them up, or on your social media platform if they follow you, you know. Healing and wellbeing pathways, so offer healing opportunities through wānanga, rongoa and cultural practices, and promote oranga whānau approaches that build resilience and safety. So these were some of the things that we that lots of Māori service providers may already be doing, but from the study, this is what the Taitamariki ideally would love. And we have only a very limited capacity within this study. So if you do it on the daily, we're really lucky that you do, and these are some of the things that you may or already do.